Michael. Hi, Michael. My name's Jamie. I'm going to be your nurse today. My name is Deb, and I'm going to be your nurse today also. How are you feeling today? Simulation education is a place for learners to be inside of a real-life environment where they get to practice taking care of patients. By patients, we use simulated high-fidelity mannequins. Then we also use standardized patients, which are actors that work here inside the simulation center. The goal of that is for the students, again, to come in and to have an opportunity to practice in this setting before and during they go out and see actual patients in a clinical setting.
I've been a nurse for 23 years, so when I went to LPN school, we had dummies. We didn't have all of the simulation stuff. And so when we first came over here and I saw actually all of the things that the mannequins can do, the scenarios, and what all plays into this, I was absolutely fascinated.
I think about, when we do scenarios and things like that, those are things that you don't forget, and it might be the silliest little thing to where, did you put the head of the bed up? I guarantee I'll never forget that now for the rest of my life. Thank you, Sim.
So simulation allows us to put the students in situations that they may not get to see in a hospital setting. And in this case, it could be a seizure. So they might not get to see, go to a neurology floor, but they might not ever get to see a seizure. We can replicate that here inside the simulation center. We also can replicate things that are high risk but low frequency, like a cardiac arrest event. So many times students will learn CPR prior to coming into the program. However, they will not have an opportunity to practice that until given a real life situation. And oftentimes nurses, healthcare practitioners are very nervous and fail to do the right steps in order to save a life. So simulation allows them to practice that and to hone in on those skills. It's not just taking care of a patient during a cardiac arrest. The sky's the limit. We can train learners to how you talk to a patient, or in death or dying situations, or it could be situations where they're talking to a mother who's getting ready to deliver a baby. I think my favorite thing about simulation in general is seeing the students learn. Seeing that light bulb, if you will, go off in their heads when they finally get a concept that maybe they tested over it and they did well on. However, once they get it and they put it all together with a situation and taking care of a true client, it's just neat to see that all happen for them, that they remembered what the diagnosis was, or the disease process was, or the condition, and they knew exactly what to do for that patient, and whether that be call the doctor or to phone respiratory therapy or to get a specific medication, they knew what to do.
Being here and practicing in the sim lab has given me the opportunity to find out what I've done wrong and what I can do to better myself as a nurse in the future. And it helps me, I guess, ultimately figure out where I need to go and what I need to improve in order to make myself a better nurse in the field and for the safety of my patients.
So as a student, when you're coming into the simulation center for the first time, it is very normal to get nervous and anxious. But remember what we said, it's a safe learning environment. Nobody's gonna fail. So if something were to happen that the patient didn't fare so well, you're not gonna fail out of your program. So keep that in mind. We wanna make sure that when you come here that you have a good learning environment and that you're able to embrace it. So we expect you to suspend your disbelief, that you embrace the environment, that we know that it's a mannequin, a plastic mannequin sitting in the bed, but we want you to think about it as if it's a real human patient. The more that you engage in that environment, the better the scenario is going to be, and the better the learning is going to, the more learning is going to take place.
It will always be something that I'm going to remember, just because The scenario seems so lifelike to the point where it has an emotional impact set on me whenever it was actually going on. So with that scenario, I will definitely remember whenever I'm out on the field. Won't make the same mistake twice.
I absolutely do believe that performing a simulation here does equip me better for the future. Just because you are practicing on something that isn't technically alive, but it does have real heart sounds and real pulses and things that do happen to it that do happen in the field. And to be able to practice that here in a safe environment has really helped me when I go into the field.
You're going to be able to have an opportunity to work autonomously as a healthcare provider by yourself with that patient, or maybe with another student, so just two of you at the bedside working with that patient, taking care of them, and having to think critically on your own and think autonomously, but also think and compare what could be going on with this patient together. So it's an amazing opportunity to learn. You are going to be nervous, but when you engage into this scenario, when you suspend your disbelief, when you forget that it's a mannequin laying in the bed and you pretend, if you will, that it is a human patient, once you're able to do that, you will find that the experience overall will be easier for you. And something else to keep in mind is the standard of what happens in Vegas stays in Vegas. We believe the same thing is true here. We respect you and will uphold everything that occurs inside of the simulation experience as confidential. So what happens in simulation stays in simulation. This is a true clinical day for students. This is considered the same as if they were going to the hospital or had a preceptor at a clinic somewhere. This is the exact same clinical situation. So respect the environment as such. Come in prepared for a clinical day. We provide all of these modules, these orientation modules for you. Be sure to go over them. I know sometimes as a former student, it's easy just to kind of peruse through stuff and not pay a lot of attention. But when you get in here and you're trying to find a piece of equipment or a supply of some kind and you have no idea where it's located at, it will make you more anxious. So the more familiar that you are through watching the videos and each time you come in, refreshing your memory to look over some of that stuff, that'll be extremely helpful for you. We will provide you what we call a pre-brief. When you come in, we're going to spend about 15 minutes just going through some of the things that we know students struggle with the most, which is the monitor, where to find supplies, the medication dispensing system, those kinds of things. But other than that, you will be expected to know the material that is inside the modules. I am so glad that you were able to come in and experience simulation education. It is not going away. You're going to see simulation throughout the rest of your career. So not only you're going to get it here in the beginning through your education, you're also going to see it after you're a practicing provider.